Atelectasis is the partial or complete collapse of the alveolar part or of the lung, leading to decreased gas expansion capacity. Is it is a condition in which the lung or a section of the does not expand fully, which reduces effect ventilation. Characterized alveolar collapse characterized by a lack of air in the affected alveoli, decreased respiratory sounds, respiratory distress, cough, sinus. Etiology, airway obstruction, blockation of airflow in the bronchi by mucus, tumor, or foreign bodies, which prevent ventilation of the alveoli, lung compression, external pressure on the lung by fluid or mice, which prevents its expansion, surfactant deficiencies, lack subac the reduced surface tension in the alveoli, causing their collapse, common in the premature newborns or in condition of the lung damage, squeezing or fibrosis, formation of scar tissues in the lung, the cause irreversible retraction and collapse the affected tissue.
Well, now I talk about the pathophysiology of obstructive atelectasis as it is the most common. This obstruction prevents the passage of oxygen and the exit of carbon dioxide through the bronchi, in turn from the alveoli and into the bloodstream. So, in this case, the alveoli is in charge of gas exchange. Since the bronchi are obstructed, there is no exit of carbon dioxide. That carbon dioxide returns of the alveoli, which is what is known as alveolar reabsorption. Then in those alveoli, there is a pressure difference, and the alveoli tend to collapse because they reabsorb gases that have to be eliminated by the atmosphere. When these alveoli collapse, gases escape, causing alveolar hypoxia. These gases then reach the blood vessels, causing pulmonary vasoconstriction to divert blood flow. And for finally, there is a collateral ventilation, that is the Lambert-Eaton channel that serves to maintain the balance of ventilation in these cases.
Atelectasia epidemiology. Post-surgical patient colon after major surgery special thorax or abdominal affecting which on 19 which general anesthesia. Chronic lung disease, ear risk wake up as or cystic fibrosis, pediatric lithophthiosis, foreign body aspirant or alcohol use in the children. Mechanic ventilation. Prolonged use in critical pain increases atelectasis risk. Global incidence common clinic settings, especially in countries with knee sugar rates.
Well, now I'm speaking about the classification of atelectasis. We have obstructive and non-obstructive atelectasis. With respect to obstructive atelectasis, also called resorption, there are the most common types of atelectasis and occur when there is a complete bronchial occlusion. The causes of these are varied, among which the following stand out. First, mucus plugs, which often occur after surgery, even caused by the same depressant drugs used. In the children, is very frequently the inhalation of objects causes obstructive atelectasis, and in adults small, it can occur when there is the presence of central bronchogenic carcinoma. Well, respect to non-obstructive atelectasis, we have three. First, relaxation atelectasis. In this type of atelectasis in particular, the lung is unable to fully expand due to obstruction due to compression by factors close the organ. Two, cicatrial atelectasis. In this type of atelectasis occurs after surgery because the scar tissue that first prevents its expansion due to its loss of elasticity. 3. Adhesive atelectasis. In this type of atelectasis, the lung will have difficulty expanding and carrying out this process due to surfactant deficiency.
Its parogenesis is the really leads to loss of alveolar volume due to several mechanisms that prevent or require lung expansion. The main process involved in clouds or way obstruction. The most common cause of the atelectasis is obstruction of the bronchi. Um, by mucous tumors, foreign bodies of extrinsic compression. This prevents the passage of air into the alveoli, resulting in the raised bursting or dry air and the collapse of the affected lung tissue. External compression of the lung. This can occur due to the presence of flight or mice in the pleural cavity gains exertion on the lung, preventing its proper expansion.
Deficits in surfactant production. Surfactant is a substance that reduces surfactant tension in the alveoli when there is decrease in this production, as in neonatal respiratory disease syndrome. The alveoli tend to collapse, contribute to development of atelectasis. Contraction atelectasis. It is less common and is associated with pulmonary fibrosis, where scar tissue causes reduction of the lungs. Parenchyma prevention is full expansion.
The symptoms present in atelectasis primarily depend on two factors. The first is the underlying disease, and the second is the extent of the obstruction. Sometimes in atelectasis may not present any symptoms unless the obstruction is significant. The symptomatology we can observe during its progression includes cough that occurs when the obstruction has developed an increase in frequency and intensity as a defense mechanism to try to resolve the blockage. Also, we have hemoptysis that may appear when the cause is the aspiration for a foreign body or an infectious process. The patient will also have dyspnea, cyanosis, and stridor that become evident when the airway stenosis occurs, and also the chest pain and fever due to secondary infection of the atelectasis. About the physical examination, in inspection we will see decreased volume and the retraction of the intercostal spaces and supraclavicular or suprasternal hollow, and also the hypomobility of the affected side. In palpation, we will have decreased respiratory movement and decreased or absent vocal vibrations. And in percussion, we will have dull or subdull sound.
In auscultation, we will have decreases or absent vesicular breath sounds, bronchial sounds, or crackly, rattles, or crepitant rattles. For a good diagnosis, it's necessary to know the patient history, such as any respiratory disease or risk factors such as being a smoker or being exposed to tobacco or wood smoke. Medical history, we have symptoms. Patient with atelectasis may present with dyspnea, chest pain, not productive cold, or shortness of breath. Symptoms usually depend on the extent of the atelectasis. Physical examination, it will depend on what is found on inspection, palpation, percussion, or auscultation. Diagnostic tests. We have chest X-ray. This is the initial and the most common diagnostic tool. In atelectasis, an area of its crazy density-wide can we be seen the affected region due to collapse of lung tissues. There may be displacement of mediastinal structures toward the affected site and elevation of the ipsilateral diaphragm. Computed tomography or CT, a chest CT scan provides more detailed images and can help identify the cause of the atelectasis, such as bronchial obstruction, measles, or restrictive compressions. It also allows for a better assessment of the extent of the collapse. Arterial blood gas analysis. In case of the extensive atelectasis, blood gas analysis may reveal hypoxemia, low blood oxygen level.